With multiple sclerosis, there is a nursing plan of care I came up with a couple different nursing diagnoses and some short-term goals to work with. One top nursing diagnosis, I think, with someone with multiple sclerosis and a possible MS flare-up is altered body image related to changes in physical body appearance and body function, possibly evidenced by decreased, self-esteem and lack of desire for socialization with others. We want to encourage patients if they are admitted to a hospital. As a nurse, with a patient going through an MS flare-up, we need to keep them close to pain-free as much as possible, keep them comfortable to the best of our ability. We want to encourage them to communicate one new kind of positive quality of self each day until discharge. So as a nurse, we would request intervention with like social services, case managers, someone that can spend a little time with the patient each day and let the patient express their concerns, their frustrations, and we don't want patients going into depression, so we want to intervene right away and do the best we can to prevent them from feeling any worse psychosocially. Second short-term goal would be for the patient to actively participate in daily exercises to return to their baseline strength and body function. As a nurse, we would get a request for physical therapy from the doctor, so physical therapy can come and work with the patient while they're in the hospital, teaching the patient exercises and ways to work with possible, muscle spasticity, lower extremities, not strong as usual, not working well, and we want to get them back to their baseline activity and strength so they can, do some of the things that they would normally do in their daily lives and get back to more normal functioning for them. Third goal would be a patient to verbalize need for assistance in relation to any kind of physical and or bodily changes. So the nurse's role here would be to educate the patient and reiterate the importance for them to call for any kind of assistance. It's not something that we want the patient to try and do things on their own if they're not strong enough, if they're not safe enough. We want the patient to feel that it is okay to ask for help and reach out. They, should not feel like they just have to lay in the bed and be isolated and not be able to do normal activities of daily living.